Hello and welcome. I'm Catherine Osborne, the founder of Corporate Harmony, providing an enlightened approach to leadership and organizational development. I am also the award winning author of the book Corporate Harmony: The Performance Link for Today's Modern Organization, and the upcoming book Healthcare Harmony: Thriving in the Line of Fire. I have a business background with a master's of business administration, and I spent many years of my career as a project manager working on an IT project where we managed multiple simultaneous projects in a highly demanding, fast paced, knowledge based environment of constant change for private public sector partnership initiative. I know all too well the challenges that leaders and employees face in today's globally competitive workplace of continuous demands for doing more with less, for higher efficiency and quality, and for change through innovation. And I'm entirely aware of the additional challenges faced with keeping people healthy, happy, and productive amid the complexity, the ambiguity, and the bureaucratic trappings of public and not for profit sector work environments. Project Healthcare Harmony is a systematic, programmatic methodology for leadership, culture, and organizational change and development. Project Healthcare Harmony is time efficient, affordable, and recognizes that an organization cannot become what its people are not, and that today's competitive advantage lies within the minds and hearts of our people. Project Healthcare Harmony is built from a three-pillar business development model consisting of first, cognitive strength. This is mind health, your thoughts and your feelings. Second, behavior skill. There are specific behavior principles that are necessary in today's knowledge economy. And third, quality management, using real time specific metrics for continuous improvement. These three pillars support your human assets, either as or with the coach, and are firmly embedded in the corporate mission and vision. So, why are these three pillars so necessary for today's workforce? How is today's workforce different than that of the past? In the past, frontline and mid level management positions were put in place to ensure that people followed rules and protocols that kept the production line moving. In today's knowledge based organizations, the workforce is comprised of knowledge workers, people with formal and or advanced education, often professionals in their own right, who bring their specialisms and expertise together to achieve corporate objectives and goals. Productivity no longer requires people's hands to keep a production line moving. Productivity and efficiency now lies in the working brains of your workforce. Hospitals are the oldest, most established form of a knowledge based organization that there is. That being said, it is imperative that we have the necessary tools and support systems in place for our mid level and frontline managers and leaders in order to create an environment in which people's minds and bodies can be as productive and efficient as possible. The question is, what does that kind of an environment look like? And how do we create it? The answers lie in the research coming from the neurosciences using advanced brain imaging technologies. Studies have proven that increased efficiency and effectiveness of knowledge workers only occurs in a positive and energized working environment. Furthermore, it has been demonstrated time and time again that employee satisfaction and engagement lies within the employee. It is intrinsic. The science is clear. Satisfaction and engagement exists only with a positive and energized mindset. Furthermore, the higher level brain function that today's employees need to achieve goals is being sabotaged by the very environment in which they work. Project Phase 1 underpins the first pillar, cognitive strength, and teaches the skill of positive presence. The skill of positive presence is your ability to adjust for and create a positive and energized mindset through conscious thought processes. This is cognitive strengthening, and it is a learned skill. Ask any high performing athlete or a person who has suffered a brain injury, and they will understand what cognitive strength is. Just as we train and exercise our body to be physically strong and healthy, we must also train and exercise our brain for a strong and healthy mind. Project Phase 2 underpins the second pillar, behavior skills. At the physical level of a positive and energized work environment is human behavior. Human behavior is the most tangible evidence of organizational culture that there is. It is also a key performance indicator for mind health. What's more, we cannot address human behavior without addressing human energy. In a positive working environment, human energy is high, positive, and coherent. In fact, a person's behavior is the physical expression of a person's human energy flow. The science of management and leadership recognizes that emotional intelligence, and more specifically, behavior skills, are the primary indicator from which to measure and build leadership's competence for creating an environment in which people's minds and bodies can be as productive and efficient as possible. A clear understanding of the three primary domains of behavior, self awareness, collaboration, and connection, is imperative, and an ongoing application of the 10 behavior principles is essential if leaders today hope to connect to the hearts and minds of their people in a positive working environment. Project Phase 3 underpins the third pillar, quality management. Management science also recognizes that for change of any kind, big or small, there must be a process of quality management, a systematic process of continuous improvement, a process that is convenient, simple, and completely transparent. Project Healthcare Harmony is a plug and play system with weekly, ongoing support. You own the project. The three project phases, cognitive strength, behavior skill, and quality management, are most effective when implemented simultaneously over a 12-month period, or they can each be a standalone project of their own. Training is immediately transferable to the workplace and meant to be shared at and with all levels of the organization. Initially, you will see conversation develop around leadership, cognitive strengthening, and workplace behavior, followed by an increased awareness of the importance of behavior, leading the way to stronger, more positive working relationships and an overall increase in employee and organizational wellness. You will see happier people aligned with your hospital's mission and vision, and with a new awareness of behavioral accountability within themselves, to each other, and across the organization. And you will see less stress and overwhelmedness with an improved capacity for agility, resilience, and most importantly, for change. Over time, you will notice improved employee engagement and wellness surveys, which in turn will drive improved clinical quality and patient care. At the same time, there will also be cost savings through less absenteeism, increased retention, and increased quality and productivity. If you are interested in experiencing any or all of these results and or to learn more, please go to our website at www.corporateharmony.ca/development and click on Project Healthcare Harmony at the bottom of the page, or contact us through email at info@corporateharmony.ca. Today is the best day to begin your own Project Healthcare Harmony.